Good morning, everyone. Thank you for joining us today. My name is Marcos Muñoz, part of the Professional Services Department at Lenticon, Spain, and I am excited to introduce you to Elipsys KC. Elipsys KC is a corneal lens with variable spherospheric posterior surface. This design allows the professional to enhance his practice by improving the corneal alignment. This better alignment will optimize tear flow, lens centering, and stability over the corneal surface. The design comes on peripheral lip control technology, which is ideal for all prolate corneas from mid to high level of eccentricity. The design has become that accurate thanks to a statistical analysis which we have used to create a nomogram. Elipsys KC is indicated for patients with irregular prolate corneas. A complete trial set has been settled to allow the contactologist to work more independently from the manufacturing laboratory. As you can see in this table, this 63 lens trial set contains base curves between 6.50 to 4.40 millimeters, eccentricities ranging between 0.80 and 1.60, and a diameter of 9.20 millimeters. All Elipsys KC are manufactured in Optimum Extra by Contamac Industries. This material offers a high oxygen permeability alongside an excellent wettability and parameter stability for all daily wear. The lenses are manufactured in blue handling tint. To select the diagnostic lens, central corneal keratometry or corneal topography is required. The diagnostic lens base curve should be 0.20 millimeters below the average keratometry. Corneal eccentricity is also required in order to select the diagnostic lens from the trial set. For mid to high corneal eccentricities, the lower diagnostic eccentricity should be selected, 0.80. For higher corneal eccentricities 1.0 or 1.20 should be chosen. And for the most extreme cases, 1.40 or 1.60. This table is a good guide to choose the most suitable eccentricities based on the corneal topography. 0.60 eccentricity or MET could be manufactured, but is not inside the 63 trial set. Here's an example. For a patient whose flat K is 6.49 millimeters and steep K is 5.82 millimeters, the average K is 6.14 millimeters. If we subtract 0.20 millimeters to the average K, the result is 5.94 millimeters. Then, the 5.9 millimeter lens should be selected. For the diagnostic lens eccentricity, we must check the corneal eccentricity. In this example, it is 0.90, which is mid-high. Eccentricity 1.0 or flat is the one to start our fitting with. So the diagnostic lens in this case will have a 5.90 millimeters base curve, 1.0 eccentricity, and a 9.20 millimeter diameter. After the diagnostic lens is placed into the eye, check the lens movement without lid interaction and evaluate the static fluorogram while manually centering the lens. Then observe movement and centration under lid interaction. This will give us a natural dynamic aspect of the current lens fit and behavior. The ideal fluorogram shows 3 tones of alignment, 2 over the corneal mid-periphery and 1 slightly aligned over the apex, without touching it, as you can see in the slide. Here is a dynamic fluorogram. Note how the tear fin flows under the lens without any heavy bearing zone. Just right edge lift and a proper movement and centration. If ideal fluorogram pattern is not achieved, evaluate if the lens is tight or flat fit. On one hand, if the edge lift is insufficient, the movement is too little, or there is fluorescein pulling over the corneal apex, that lens is tightly fitted. To improve that fit, we must flatten the lens's base curve, increase eccentricity, or decrease diameter. On the other hand, if there are central heavy bearing zones, edge completely lift, and central corneal staining, the lens is flat fit. We need a steeper base curve and or lower eccentricity. The peripheral lift control technology allows us to have a precise control over the edge lift, while increasing or decreasing the lens posterior surface eccentricity. If the edge lift is insufficient, the eccentricity should be increased, for example, by moving from MET 2 to flat or flat 2. If the edge lift is excessive, the eccentricity of the lens should be reduced, for example, by moving from flat 2 to flat or MET 2. Take a close look at these videos. They show the same eye with different peripheral lifts. The video on the left shows a lens with a poor movement and minimal lid interaction. The video on the right demonstrates better lens movement, proper tear flow beneath the lens, and, of course, improved edge lift. For issues like low centration, high centration, central staining, or dimple veiling, adjust the diameter and eccentricity accordingly. A flat fit contact lens may ride high due to excessive lid interaction, while a tight fit lens may ride low due to reduced movement, minimal lid interaction, and poor tear flow between the lens and the cornea. If there are nasal or temporal staining zones, it could be due to insufficient edge lift for a toric cornea. To address this, you can reduce the diameter or increase the lens eccentricity. After obtaining a proper fluorogram centration and movement, perform over-refraction and convert it with vertex distance if needed. After obtaining a proper fluorogram centration and movement, perform over-refraction and convert it with vertex distance if needed. The final lens power is calculated as the diagnostic lens power plus the over-refraction. Remember that this design does not compensate for internal astigmatism. If this astigmatism appears, we must consider other designs, such as ICD flex fit. After the base curve is selected and the final lens power is calculated, any empirical base curve change should be reflected in the lens power due to the inherent change in lacrimal lens. How many diopters? 0.25 diopters for every 0.05 millimeters base curve change. For a steeper base curve, this power change should be subtracted, more negative, and for flattened base curve, the power should be added, more positive. When the diameter changes, the base curve should also be adjusted to maintain the fitting relationship between the cornea and the contact lens. For every 0.40 millimeter change in diameter, the base curve should be adjusted by 0.05 millimeters with the corresponding power adjustment. For an increase in diameter, the base curve must be made flatter, while for a decrease in diameter, the base curve should be made steeper. These are the parameters that are needed to place the order: the design, Elipsys KC, base curve, power, whether it's the diagnostic lens power and over fraction, or final power, diameter, and eccentricity level. As you know, there are different keratoconus shapes, depending on where the apex is located and its shape. Central or nipple cones will require lenses in small diameters and lower levels of eccentricity. They will be easy-centered. Oval cones will require medium to large diameter lenses, as well as medium eccentricities. They will be low-centered, always over the apex. Pellucid or inferior cones will need larger diameters and high levels of eccentricity. Lenses over oval or inferior cones will be always for sure low-centered. We must ensure a good pupil coverage even in low light environments in order to avoid glare phenomena. Ask your patient to thoroughly wash his hand with soap and water, and to dry their hands with a lint-free towel to avoid transferring debris to the lens. Rinse the lens with a recommended cleaning solution to remove any debris. Use the index finger to position the lens, and with his non-dominant hand, use the middle finger to hold the upper eyelid firmly open, ensuring any blink during insertion. With the middle finger of his dominant hand, the same hand holding the lens, pull down the lower eyelid to create enough space for the lens. While looking straight ahead or slightly downwards, gently place the lens directly onto the center of the eye. To remove the lenses, instruct your patient to use the index finger of their dominant hand to hold the upper eyelid over the upper edge of the lens and the lower eyelid over the lower edge of the lens. Then, ask them to gently pinch their eyelids together with their fingers. Thank you very much for attending this webinar. My name is Marcos Muñoz, and it has been a pleasure sharing Elipsys KC with you all. Goodbye.